WLW.com.
I broke 1,000 hearts before I met you. I break 1,000 more, baby, before I am through. I wanna be yours, pretty baby, yours and yours alone. I'm here to tell you, honey, that I'm bad to the bone, bad to the bone, bad to the bone.
America began this morning stunned and uncertain and flummoxed. All is now clear. The clouds have parted. The sun is shining. The king, LeBron James, the chosen one, has returned to Cleveland. At some point, the voice of the common man will go to Cleveland and unite the empires of the South and the empires of the North. But until then, until that moment arises, Dr. John Mendelsohn is here, the plastic surgeon of the stars. Dr. John Mendelsohn, welcome again to the Bill Cunningham Show.
Thank you, Bill.
Segment Dennison has a tattoo on his back that says, LeBron James sucks. He now wants to change that tattoo. He had that put 4 years ago in. Can you help Seg with his LeBron James sucks tattoo?
We can. We can do it well. What does he want to replace it with?
LeBron James is the king.
Ah, well, that's good. We just have to remove one word then from that.
How do you remove one word sucks from Segman's generous back with lots of hair and skin folds?
Well, there is a wonderful new technology, probably the newest technology in 2 decades, called the Picosure Laser, and it's used for tattoo removal. It's also used for pigmented lesions, brown lesions. So in the past, patients who've had tattoos that they might regret, they want removed, maybe replaced, would undergo treatments with former technologies, something called the Q-switched laser. And it may take up to 20 treatments with those lasers, maybe 6 or 8 weeks apart. With the Picosure, the same tattoos can be removed in typically about 3 treatments, about 4 weeks apart, and it is absolutely phenomenal. This laser fires at 1 trillionth of a second.
1 trillionth of a second.
1 trillionth of a second.
That's quick, John. That's quick.
Yeah, a trillionth of a second. A picosecond is to a second, as a second is to 37,000 years.
Wait a minute. Now you're going too quick for me. I don't understand this. Explain the comparison.
Yeah, so what happens is with the older technologies, there was what we call a photothermal reaction. So you're heating up the skin, breaking up the tissue, and allowing an inflammatory response in your skin basically to absorb the pigment. And it didn't work. It really worked with black ink. It didn't work with blue real well, didn't work with green, yellow, red. And so you were somewhat limited. Because this is so fast, the surrounding tissue doesn't get heated up, so you don't have that inflammatory response, and what we call it is a photomechanical. Real simply, Bill, it's shattering this ink into dust, and your body is simply resorbing those particles. It's absolutely phenomenal.
Does it look as if you've done that? By that I mean, if there's paint on a wall and you take out the paint, you can still see something was there. Is that the way Pico works?
Yeah, if you the older technologies looked that way, and they looked that way for a number of reasons, because it was disturbing the surrounding tissue, creating pigmentary problems, and often didn't remove the pigment that it was intended to remove. With the Picosure, you don't see that. It literally is just breaking these down into microscopic dust particles, and your body's resorbing it. Now, depending upon the color of your skin and what else is going on, you may see some remnant. But what we've learned is just like in your example with LeBron here is, people love their tattoos. They just might regret, or they might want to change them. Well, they might want new art on them. And but bottom line, though, Bill, if you research this, you'll see that these can be removed. You don't need to replace anything. It is absolutely incredible. About what does it cost, if anything? Yeah, so traditionally, per square inch, if you had a 1 by 1 square inch tattoo, you'd be charged $200 per square inch per treatment. So if you do the math, you've got 10 treatments to 20 treatments, you've got $2,000 to $4,000. These treatments usually begin around $1,500. So it's affordable. You can remove them more quickly. Remember, if you're treating somebody every 6 to 8 weeks over 20 treatments, it takes you forever to get rid of that tattoo. So this is a super effective and affordable way to have tattoos removed.
Now, as far as kinds of tattoos, are bright colors different than dull colors? Is script easier than block? Does that make any difference?
Script and block don't matter. The color matters and the size matters. But black is the easiest traditionally, and that's what people would have removed. But the Picosure treats all colors, and it treats all colors well. So these days, it doesn't make a difference anymore.
Well, Seg also has a NASCAR tattoo of Dale Earnhardt Sr.'s number 3 car on his back. And he liked to have that removed and put 88 in its place.
Well, depending on where the tattoo is, if we can remove the 3 and replace it with 88, that works. But really, you can remove whichever portions of tattoos you like. And I mentioned earlier, this also removes pigmented lesions. Usually 100% removal within 1 to 2 treatments.
What does that mean? What do you mean by a lesion? You mean like a mole?
Yeah, good question. A flat mole, if it's brown, pigmented, melasma in women with pregnancy, sun damage, anything that's really brown, throughout your body or face, the Picosure works to break up the melanin, the pigment there as well.
Does it have a cancer risk? Whenever you mess around, one of my good friends is Dr. Paul Lucky, a dermatologist. Yep. And he's a great guy, and I go see him twice a year to get my barnacles off, and he always tells me, stay out of sun, radiation, wear sunscreen constantly. Does this present a risk of radiation or damage and causing cancer?
No. This is an FDA-approved device. It's a huge breakthrough worldwide in technology, and there's no additional risk. It works beautifully for what it does.
Does it have other functions, this Pico technology, other than the mole removal and coloring and the tattoos? Yeah,
it's an excellent question, Bill. And they are finding other uses. I think we're just on the infancy of what this technology will do. So right now we're treating pigmented lesions, and it's used for tattoo removal.
But you're not sure?
We're not sure. They continue to study, and we're seeing other uses for it. And I'm sure that the Pico technology will be something that we will be hearing more of for other treatments.
How many years ago, approximately, were you in medical school?
Oh my, medical school, 1988.
So 25 years.
That's about right.
Imagine where the science has come in those 25 years, but imagine where it's going to go in the next 25. Where will it go in the next 25?
Oh, my God, remarkable. I mean, with all the computer technology, I think we'll be, eating or swallowing, computer chips somehow, surveying our body, releasing, hormones, doing, programming it to do what we need to do to monitor, our homeostasis, our bodily functions. So who knows?
So you think this is heading toward like a pill, a capsule about the size maybe of an aspirin that one would swallow, and then that would give within a couple days the medical community an entire picture of a person's body?
Yes, absolutely. Not only that, I think we'll probably be able to distribute, chemotherapy or other drug agents, depending on what we're doing, or insulin. Yeah, I think that's where we're headed.
Now, when this news came out today at 12:25 about LeBron James coming back to Cleveland, what was it like there in your office in Rookwood? I would imagine I looked at CNBC, CNN, and Fox. I have 3 TVs up. All of them had flash news stories. I thought maybe the market had crashed 500 points, and it was about LeBron. I thought maybe there was an attack on the homeland, and I'm looking to my right. The flash was LeBron James is returning to Cleveland. When this happened at 12:25, what was it like at John Mendelsohn's office?
We will continue to move along and treat patients. I was listening earlier to Dr. Kremchek, and I think I mimic some of his feelings. Good for LeBron. Doesn't matter as much to me. I'm a Syracuse University basketball fan, so no changes in our office.
Nothing. There wasn't people, the nurses, the support staff, other physicians weren't running around throwing confetti and having a lot of fun. That didn't happen.
Love to tell you otherwise, but I think many are unaware. At
the Advanced Cosmetic Surgery and Laser Center there in Hyde Park, you're on Edwards Road, Rookwood Pottery. What is the number one procedure that you do?
Wow. Well, I break that down into injectables and non-surgical, Botox and fillers, Voluma, and, of course, surgically, lots of facelifts, eyelid surgeries, rhinoplasties, and skin treatments.
If we referred Segment Dennison to you, he weighs something in the range of 350 pounds.
Mm-hmm.
Could you take off 70 or 80 pounds of unwanted fat?
Absolutely. Dr. Meyer here could assist with that quite nicely, but we can remove things non-surgically using cool sculpting, but Dr. Meyer might do tummy tucks or liposuction to remove unwanted fat.
Well, that's most of his body, though.
Well, and it will be his choice. We'll work on the tattoo first.
Dr. John Mendelsohn, do you have any questions for me about world capitals, mathematics, politics, something about geomorphology, something that's confused you over the years?
Well, tell me what you think about the situation over in the Middle East there.
Oh, my God. I think at the bottom of this well, at the core, at the foundation of the difficulty, is that the Islamic extremists do not want to live in peace, but the Israelis would love to live in peace. When you have a popular election among literally hundreds of thousands of so-called Palestinians, and they freely elect Hamas to be their representative, when they're told the things they're told, when they're taught the things their children are taught about Jews and Christians, it is almost impossible to have peace with someone committed to your death, to your destruction. When they can freely kill children in nursery homes, when they can blow up patrons in pizza parlors, when they can lob hundreds of missiles into Israeli cities, that tells you the degree of the hate. And for those of us that don't understand, imagine what would happen if Mexico or Canada were lobbing hundreds of missiles into New York City, into Washington, into Detroit, and Cincinnati. Well, what if the Canadians had the ability of lobbing missiles into Cincinnati and hundreds of missiles hit in Cincinnati? What would we do, Doctor? Would we say, well, it's okay, let's go to the... We would respond against those seeking to kill us. At the end of the day, until Islamic extremists accept the Israeli state as free, open, and democratic as their partner and as their neighbor, there's no hope for peace anywhere.
So, what do you think the U.S. response will be to that?
Because we have a president who is the most anti-Israeli president in American history. And I'll give you one glimpse that Sherlock Holmes wouldn't need to figure out. The Gallup organization, which is a fairly middle-of-the-road, important polling organization in America, did a poll the last 3 weeks on different religious groups in America and their support for the president. 72% of American Muslims like what Obama is doing. Mm-hmm. When 72% of American Muslims like what Obama is doing in the Middle East, to me, that's a problem. Any other questions?
No, but thank you very much, Bill.
Dr. John Mendelsohn, you're a great American.
Thank you very much. Have a great day.
Thank you. LeBron James sucks. 1-inch high block letters on Segment Dennison's back. He wants the word sucks removed, and Dr. John Mendelsohn can do it.